being in practice for a few years, I realized there's a lot of dimensions that we're not touching on. And I like to say that the MD stands for multidimensional, not minor deity. And now, I don't want to just knock on my profession, but I'm a little upset with the medical system. And what I always say to patients is that doctors have no special intelligence. Okay, we do have experience and training, but you know your body better than anybody. Okay, so heads are nodding, and I don't know. I don't make any assumptions, but sometimes the stories I hear from patients are disturbing to me. I see a lot of kids with neurodevelopmental disorders, autism and Down syndrome, and the doctors will say, the parents, diet makes no difference, which to me is crazy. Or with inflammatory bowel disease, oh, eat anything you want. So I see some heads. So that's the background, but I like to try and approach things from a systems approach. And there's two quotes I always keep in mind. One is from the 1600s. I observe the physician with the same diligence as the disease. All right. Yeah. And then Florence Nightingale, she was a real innovator in the 1850s about sanitation and cleanliness, and really improved soldiers' mortality in war by what we would consider very basic now. But remember, it takes a long time for things to change. And Florence Nightingale was a real innovator in just getting people to wash their hands. And she said, the specific disease doctrine, and that's like we see that now where there's one drug to treat something and there's one cause for something, is the grand refuge of weak, uncultured, unstable minds such as now rule in the medical profession. So next time your doctor says, oh, you can just look at the TSH and nothing else, you can tell him or her they have a weak, uncultured, unstable mind, such as now rule in the medical profession. That's 100 years ago. But seriously, it's something to keep in mind, because I don't come from the view of trying to make anybody wrong. It's really what works for you. But it does remind me of another story. If I say the name of Dr. Semmelweis, is that, well, he was a young physician about 100 years ago, a little more, in Vienna, which at that time was the center of learning in the Western world. And he made a simple observation that when the midwives did deliveries, the death rate, it was called childbed fever, was 1%. When doctors did deliveries, the death rate was 16%, 16 times greater. Now you'd think this would be a little bit obvious. So he had the brilliant idea of thinking, why might this be the case? So he looked around and he saw the difference was the midwives washed their hands in carbolic acid, one of the first come. The doctors would do an autopsy, then go from mother to mother delivering babies without washing their hands. Okay, and he said, well, geez, maybe there's something that, maybe that's the reason the death rate's 16 times higher. Now, when I say doctors have no special intelligence, why didn't the doctors wash their hands back then? And the answer was that they believed what Aristotle said some 2,000 years beforehand, that disease was caused by bad humors, phlegmatic, choleric. The microscope had been invented. You could see the bacteria. We can look back and say, well, this is ridiculous, but at the time, it wasn't so simple, because when they did autopsies, there were different organs involved, and the thought was if it was a bacteria, there should only be one organ involved. Now we know things are more complex, but whatever that was, the doctor's excuse. Plus, doctors didn't want to think they could be causing disease. So it was like, well, it can't be our fault that there's death rates. So young Semmelweis went to the esteemed professor of obstetrics at the medical school and said, we should do a research study. If half the doctors wash their hands and half not. And he was laughed out of the office, and the brilliant answer given was, the reason the death rate is 16 times higher, now this is Victorian times, is the impropriety of males examining females. This was a brilliant logic. Now, that sounds funny, but if you fast forward to 1960s and early 70s when I was in medical school, the reason that was taught from the University of Chicago, which is one of our more esteemed universities, that kids were autistic is because the moms were cold and unemotional. And I heard that word refrigerator moms. So I think to me that's a kind of similar thinking and ignorance. What's wrong? So anyway, Dr. Semmelweis went ahead and did the study, got the death rate down to 0.5% with good sterile technique. Did anyone listen to him? No. Okay. He died in an insane asylum. He was on the fringe and was ignored, and no one knows the details. It's a sad story, but 40 years after he died, the university was named after him. So it does happen, it just takes time. And I don't separate what's happening with thyroid with what's obvious. Everyone knows the elephant in the room. It might be your thyroid. So definitely the thyroid issue is the elephant in the room that's being ignored so much. So as a systems, I always like the tree image. When we look at the body or anything in biology, our medicine now, and this is obviously sometimes necessary, is focused here out at the branches and the ends between cardiology, endocrinology, gastroenterology, hepatology. And sometimes that's appropriate, but more often than not, with the chronic unwellness, we have a new phrase that's developed, complex chronic illness. You have to look down the trunk and the roots to see what's going on. And I think this will be the medicine of the 21st century. It's called systems biology or integrative medicine, functional medicine, understanding how the whole system works, And I do say, if you're hit by a truck, don't do aromatherapy. Wait till you're healing, because, aromatherapy is very effective, but you have to use it at the appropriate time. So this new way of thinking that I like to call, or that is being called functional medicine, looks at fundamental causes of the chronic illness or unwellness rather than symptomatic consequences. And again, you have to be appropriate. I do a lot of work in my shop, and I got a small piece of steel wool on my finger. And I was trying to do everything I could, holistic soaking and colloidal silver, and trying to get under the nail. I got under the nail. And it was getting worse. It was pretty painful. So I finally had to see a hand surgeon. And I do think it's good for doctors to be in pain and understand. You want to forget what that's like, but anesthetized it and took a lance and slit the thumb open, and all this pus poured out. He said, don't treat a surgical problem medically or a medical problem surgically. So fortunately minor, but I had a surgical problem and had to be dealt with surgically. But it's really the biochemical individuality. I tell each patient in the office, you are 1 in 7 billion. We know no two people are the same, and you can't do a cookbook approach when it comes to trying to figure out what's happening. So I like this image of the different levels. Here we have the whole person, organism, and then you have the organ system, and then the cells. Then inside the cells, and the cells being made up of molecules. So these systems are all talking to each other. And so much of our Western medicine is taking things apart down to the molecular level and thinking we understand it all. So again, that gives a lot of knowledge and information, but it's not the whole story in terms of how the things are interacting or just talking to each other. And your body has to synchronize everything over so many, orders of magnitude. When I use that term, that means powers of 10. Like your body is synchronizing down the trillionths of a second to months or years for your circadian rhythm during the day. And it's all got to work smoothly. And then part of what we're seeing now with the term endocrine disruptors and environmental pollutants, they affect your ability to communicate for your nerve cells and your endocrine cells. Because when your body makes a hormone, like thyroid hormone, it could last for hours. We call it a half-life before it's being used up. And the endocrine disruptors from the environment, when they enter your body, it can affect your thyroid receptors in your cells, or your hormonal receptors for estrogen, testosterone, etc. And those have a half-life of 15 years. So think about that difference. You know, our human-made chemicals. There are now 90,000 chemicals in the environment that have potential effect. About 20,000 that affect the nervous system. How many have been tested? Maybe less than 1%. So it's something that I think we all need to be aware of. It's another discussion we could do on detox and that type of thing, what to do about it. But just, you know, the awareness, and it does affect the thyroid, because some of these endocrine disruptors, we call they're false analogs. When they get into your body, it tells your pituitary that controls thyroid that you have enough thyroid in your system when you don't. So it's all these layers of how they come together that we need to look at, and there are ways to do that. Just talking about systems, it's interesting that no one really understands what consciousness is. You know, probably our most complex system is the brain. So the brain has to coordinate everything, and all the parts of the body have to be talking to each other and controlling it. And there's no hierarchy. It's not like there's a king or queen giving orders. It's just how your system can work together. So I think there'll be more available to be able to look at the body on these levels. And some of you may have heard the test 23andMe. Well, that's a genetic test. It measures 920,000 genetic variations, 920,000. 10 years ago, it cost $10 million. Now, I know most people here are not part of the Gates family, so couldn't afford it, but today it costs $99, and the interpretation costs $20. So that's still not the best test, but it's what's available now, what's called microRNAs and metabolomics will be coming that give a better idea. So we talked about fundamental causes. You know, my son sent me this the other day. I was going to put in slides, it was too long, but the number of Americans taking drugs and the number of people on psychoactive drugs, it's called The Drugging of America. It was on a website, Zero Hedge, and got picked up, but it's pretty staggering, you know, now people taking drugs. And do you know what the number one profit industry is in this country? Right. And number two is oil. So that's what we're dealing with. We won't discuss that tonight. So the way I like to approach this when I see a person is first normal physiology. You know, and that certainly talks to thyroid. I mean, you want to get your body operating in normal physiological fashion. Second is a mind-body connection. You know, when I was a student, it was a big argument. We call it psychosomatic, which came first. But now we know that anything that affects your perception or your awareness affects your body, and anything that affects your body affects your perception or your awareness. So you can't separate the two. Third is using natural treatments when possible. And fourth is pharmaceuticals. And when dealing with thyroid, this is one of the few times where I'll move pharmaceuticals up the scale, because of course a natural desiccated thyroid would be a glandular. And if you want to argue it's pharmaceutical or not, and as an Armour thyroid or Nature thyroid, that would actually be a glandular. And 80% of people do feel better with that form of thyroid, not 100%. But the idea that thyroid really is supportive with our 21st century living. You know, it's supporting the body. It's bioidentical. So with thyroid, it's a case where it might look at the pharmaceutical treatment sooner rather than later. Just visually, you know, everyone knows the thyroid gland is just below the Adam's apple. Here's a little bit of an enlarged picture. And we won't get a lot into it, but just so that whole idea of the autoimmunity antibodies. Unfortunately, we're seeing more autoimmune diseases. Depending on which studies you look at, they've increased from like 50 to 100-fold. And when I say Hashimoto's thyroiditis, are most people familiar with that? Mm-hmm. Okay. So that's an autoimmune disease where the body attacks your thyroid and you get low thyroid. Graves' disease is the opposite. And just briefly, when this is the bloodstream and this is inside the thyroid gland, and your body has to take the iodine out of the blood. Now, the thyroid hormone is very simple. It's just made of the amino acid tyrosine. Okay, it's a very simple amino acid, and your body puts iodine onto the tyrosine. It actually takes two tyrosines and puts them together. These little circles, these six-sided rings here, puts two of them together. That's right here. See, they're strung together. And those magenta dots are iodine molecules. So when there are 4 iodines, that's T4. It's really pretty simple. I know if you're not familiar with it, it seems more complicated sometimes than it is. And 3 iodines is T3. So, the iodine has to come in. These are the cells, and it's put into what's called the follicle in the thyroid. When you can, sometimes people will have thyroid nodules that are enlarged. That's from the follicle expanding. Then that's to be put back out, iodine added, combined together, put back out into the bloodstream. So that's just a little overview on the thyroid function. And this is from an old textbook picture, but you can see the difference between low thyroid and normal thyroid. In the neck, the swelling. And then there's so many levels of control. It's not like you turn a switch on and off the way we would think about it if we were designing a mechanical system. But the hypothalamus talks to the pituitary, and then pituitary is what actually releases the TSH. And by that I mean thyroid stimulating hormone, which I think most people are familiar with. That's the commonest test. And then the thyroid releases T3 and T4, mostly T4, and then where it's needed, it's converted to T3 in the body. And T3 is the active hormone, or again, technically about 5 times more active than T4. And the T3 has a short half-life in terms of hours, but the T4 has a longer half-life, up to 16 hours. And most of the thyroid hormone is bound up in the body, in the bloodstream. It's bound to protein. And that's why we look at the free T4 and the free T3. So you can see just in this one simple thyroid example, there's so many levels of control and feedback and storage. So, All right, symptoms of low thyroid. I won't go through this, but it's a long list. Some of them can go on to 2 pages. And it won't be the same in any one person. There are people who have low thyroid and have no fatigue, but they're constipated. I mean, that's unusual, but it does happen. Sometimes cognitive function and depression is low thyroid. Before all the fancy tests were available, psychiatrists would always give thyroid if someone was depressed. And, because of all the symptom overlap. But the thyroid is really your metabolic powerhouse. I'll often say to patients, thyroid is like the spark plug for every cell in your body. And then I said that to a patient last week, and a young woman, she says, what's a spark plug? So I just, well, if you hadn't heard it before, but everyone knows what a spark plug is. Okay. And then just mentioning that one of the crucial things about thyroid is in the brain. If a mother has low thyroid during pregnancy, it's cretinism. The child will be born retarded, and it's not reversible because all the neuronal connections are rapidly forming. I just read these figures, well, if I get them right, like during the 9th month of gestation in the womb, you're making like 60 billion connections a minute in your brain. And the thyroid has to be right for that to happen. But in terms of making new nerve cells, how they migrate, the dendrites and Axonal growth is how the cells, brain cells connect. The synapses is a gap between the cells. So for plasticity, where you can learn new things, to remember something, your brain has to be plastic and add that new memory into your brain. Thyroid is critical. And prevents degeneration. So here's a quiz for everybody. Can anyone tell me what normal is? You know, there's always these new normals. When I'm at conferences and I get discussion with colleagues, I can always say, well, I am the norm. So, but in 2002, the endocrinologists and American Academy of Endocrinologists met and said, well, the new normal is now 0.3. This is for TSH. Sorry, it's not in there. TSH 0.3 to 3. Now, does anyone know, if you look at your lab slips, what the thyroid TSH normal is listed as? Some say 5. I've seen 5.2. Some say 4.5. So, you know, call up the lab and tell them that they're 14 years behind. But this is a really important point that I always go over with patients. When you see these normal ranges, okay, God did not come down and say this is normal. These are statistical things based on that bell-shaped curve. You may have seen that. It's called the Gaussian distribution. So that's the assumption, is that we're a bell-shaped curve. Many times we are, but there's a lot of, as we said, individual variation. It's an interesting mathematical history that bell-shaped curve came about from two famous French mathematicians, Fermat and Pascal, and they were friends with the French aristocrats in the 1700s, and it was very popular to play dice, roll the dice. And so they were trying to figure out their odds to be able to win, so they approached their mathematical friends. And in 2 letters back and forth, they developed all statistical theory. It was just an amazing accomplishment in mathematics. But getting back to people, we're not rolling dice, individuals. But that's the assumption, is that you take 1,000 people walking by the door, and the top 2.5% are abnormal, and the bottom 2.5% are abnormal. So what does that mean if you're 2.4% or 2.6%? It's really hard to interpret, you know. So what does it mean if a lot of people are low thyroid and you're calling them normal? And that means it will shift the TSH to a higher number. And that's what was happening. Now in 2005, so this is the Society of Endocrinologists, what the normal is for TSH. In 2005, 3 years later, a research study said, no, the new normal should be 0.5 to 2.5. And they looked at, it was a large study, 13,344 subjects, and 95% were in this range. Now, it doesn't mean if you're 2.4 you're normal and 2.6 you're abnormal, but you get the idea that it's important to understand how these numbers come about. And unfortunately, in a lot of the systems, medical systems, if you have 10 minutes for offices, that you just don't have time to look at these variables. You really have to think about it a little more. The average across all ages was 1.49. That's kind of what's in the middle. And often that is the case. You want to be pretty close to the middle, maybe 25%. So that, you know, between 1 and 2, I would say, is optimal. So the president of the American Endocrinology Society, from that first study in 2002, the prevalence of undiagnosed thyroid disease is shockingly high, since it's easy to diagnose and treat. It is one of the easiest things to treat. I don't want to lead you there, but it's really pretty easy to treat. The new TS range, 0.3 to 3, will diagnose thyroid disease before more serious problems like elevated cholesterol, heart disease, osteoporosis, infertility, and depression, and more people with minor thyroid abnormalities than previously perceived. So that's the American Endocrinology Society, but it's still not gotten to general practice. it might be another 10 years, I'm guessing, and that's guesstimate, 10 to 20 years before some new understandings actually make it into the field. And just two things that are often not looked at with low thyroid. Again, cholesterol. Thyroid is your spark plug. So if your thyroid's low, meaning your TSH is high, what's your cholesterol going to be? Higher. It's amazing. People have been trying to lower the cholesterols for sometimes years. And then we find out the thyroid is low, and then the cholesterols go from 280 to 210 in like 3 weeks, just getting the thyroid balance. So diet will do that too, by the way. So we can see a lot of changes. And then looking at low thyroid depression, and then intersect there how much they overlap with common symptoms. So we don't always need to do this much, but this is of course the base. TSH we mentioned. The free T3, the old studies, the T4, thyroxine, and total T3 don't tell you what's available to the body. Most of your thyroid is in storage. If it's needed, it's bound up by the protein in the bloodstream. So the free T3 and the free T4 tell what's actually available to the body. Reverse T3, are most people familiar with what that is? Does someone want to shout that out? And then you'll be a pop quiz in 10 minutes. So, okay, well, remember when we said that T3 had 3 iodine molecules on it, and T4 had 4? Yeah. Okay, so it's like what would be called a mirror image. If you have 3 places, if you have 4 possibilities in 3 places to put the iodine, if one goes here, it's active metabolically. If one goes here, it's reverse T3. It blocks the thyroid. Okay, so it's even level. We didn't mention the reverse T3. If you're under stress, the body will make more reverse T3. Now, I think you could think about why that might be true in terms of the wisdom of the body, but we're under different stressors now, where at one point most of our stress was for survival. You've heard of the fight or flight response? You know, that really engages your whole system to fight or flight. Unfortunately now, if you're sitting in a traffic light, late for a meeting or stuck in traffic like I was, your body responds the same way if you're threatened by survival. So you can't tell the difference. Or I like to say the fight now is with the boss, and the flight is the one that you missed. So, you know, you're always, these little things, we can't shut them off, but that often will increase the reverse T3. So we often will need to look at the stress questions. Thyroid antibodies, I'll say a little more about that in a moment. Adrenal glands, I have a slide a little bit, but you know, when we deal with complex chronic illness, you need a way to understand it. And there's something that I call triads. It's like a stool with 3 legs. If one of those legs is short, the stool is unstable or out of balance. So I think the most basic triad is going to be the thyroid, the adrenal, and I would say blood sugar and pancreas, because that's where most people start to go off. So you can, it's a way to understand what happens. Those are the most basic things. People start getting low blood sugar, start getting more carbs because they're tired in the morning, start drinking more coffee, especially at work. So many people I see, they say, you know, there's all this stuff at work. People bring in donuts and sweets and that type of thing. So with those ups and downs in blood sugar, that stresses your adrenal glands. Your adrenal glands are always monitoring your blood sugar. If your blood sugar drops 2%, it will put out cortisol and take your body apart, literally, because you can make sugar from protein and fat. And I don't know if there are any questions on it, but the whole paleo diet and the gluten thing, I was going to put something in, but it's just too much for tonight. But that whole question of sugar balance, adrenal function, and thyroid are all tied together. So looking at adrenal function, very old-fashioned, but can be very helpful, is taking your body's what's called basal temperature. And I have people put a thermometer right by the bedside. First thing they do in the morning when they get up is put the thermometer in their mouth. And a lot of people have very low basal temperatures. Thyroid is not the only reason. The other main reason is excess stress hormones. We'll do that also. Vitamin D, copper, zinc. I'll have a slide about what all the minerals you need to get the thyroid functioning. All those steps that I showed you in the earlier slide, iodine has to come in and then be combined and come out of the cell, requires a lot of minerals, specifically zinc, selenium, and iron. So allergy testing, heavy metals, they can interfere with thyroid function. Celiac. By the way, we see this a lot now, of course, with the gluten question, but thyroid antibodies can be the first sign of celiac disease or gluten intolerance. So,
could you repeat that again, please?
Yeah, the thyroid antibody is called a TPO, thyroid peroxidase. If that's elevated, that could be the first sign of celiac disease or gluten intolerance.
Can you rely on the ranges provided on the lab reports for those antibodies?
Yes, they are. Well, good question. Typically, from what patients tell me and being at conferences, I'll use the word mainstream, I don't know what word to use. And mainstream endocrinologists will say, yes, you have Hashimoto's, they're elevated, you can't do anything about it. You know, here's the script. And that's usually when the office visit ends, right? Take out your script, write it. It's kind of a joke in medical school, we call that communication interruptus. Because, you know, that's when the session's over. On the next patient. But we see them come, I'd say, 3/4 of the time they'll normalize. Because if it's coming from the gut and the gluten question, then your body will stop attacking. I mean, the body's recognizing your thyroid as foreign. It may be cross-reactivity. This is some newer research, but the structure of gluten has some similarity with your thyroid. So when your body makes an antibody to gluten, it then will attack your thyroid. So, I mean, it all does fit together, but HLA, these are what are called histocompatibility. Yeah.
Basal body temperature, should it be 98.6?
Well, yeah, it depends which book you look at, or which website. I think above 97.6, 97.8 would be normal. Because it takes a while. That's why it's good to do. But you really have to do it the moment you wake up before you get out of bed. Because your thyroid is lowest like 2, 3, 4 in the morning. And then like 5 or 6 it starts to increase getting ready for the day. So thyroid is really a function. Your body temperature normally is determined by thyroid function. The allergy testing, immune testing. Then the sex hormones, I think sometimes that's started too early, hormonal treatment, when the real problem, again, I mentioned those triads, which helped me. The first one, as mentioned, is thyroid, adrenals, and pancreas. The second is gut, brain, immune system. And you can see.
You just made a statement that the thyroid is the lowest around 4 o'clock in the morning.
Yeah.
Is there a coincidence why I always wake up at 4 o'clock in the morning?
Good question. Do you have thoughts?
You know, causing my temperature, you know, because I usually wake up and I feel cold or I'm getting a hot flush.
Well, I don't want to get too personal, but do you have any thoughts when you wake up? Or you just?
I just always wake up at that time. I don't know.
Are you able to get back to sleep?
No.
So you're up the rest of the night?
Well, at least for a good hour or so.
Do you take anything?
I take too much of, I take melatonin, I take magnesium, I take passion flower, I try everything.
And do you take melatonin when you wake up?
I'll get up and go downstairs and take it when I'm desperate.
Does it help?
Sometimes.
What form of melatonin are you taking?
Right now I'm taking a type that you chew. They're like in gummy form. They're, you know, you chew them in your mouth. But
Yeah, to get to back to your, I don't know is the answer. I generally
maybe it might, you know.
probably not. There's probably another reason,
Okay.
but we do suggest putting the melatonin by the bedside, and then when you wake up, if it helps you get back to sleep. You can put it right under your upper lip, melatonin, and the blood supply goes right back to the brain, and hopefully get back to sleep in 5 or 10 minutes. Other thing we see good results with is theanine. It's a green tea extract, and that's particularly good if anxiety is an issue. But the theanine is the calming part of the green tea. So the extract is really a good anti-anxiety. It puts your brain into an alpha state, like your meditative state, and it's really non-sedating. It's safe up to 2,000 milligrams, and that can help with the sleep. Candida and mold testing, because these can interfere with thyroid function. Celiac we mentioned. So this, I like this diagram. I often go over with patients to get a feeling for it, but we're starting with the thyroid. Remember, there are 2 levels above the thyroid that control it. So this is the pop quiz. What were those 2 levels? Pituitary and above the pituitary? Wait, good. So just starting at the thyroid, which is where the TSH comes from, the pituitary, tells the thyroid to make thyroid. So it makes T4, and then the T4 can is changed to T3. And how many forms of T3 are there? Right. And how many iodine molecules on T3? And if one's in the wrong position, it's called simplified RT3. So RT3, does that have any thyroid action or function? No. It actually blocks, puts the brakes on the thyroid. Again, it's another control point for the thyroid. So this is really the real deal, T3. Can everyone read this here? No. Okay. So to make thyroid, you need iron, iodine. Tyrosine is the amino acid. Again, thyroid hormone is just tyrosine and iodine. That's all it is, the amino acid tyrosine with iodine. Zinc for the enzymes, selenium for the enzymes, and these vitamins E, B2, B3, B6, C, and D. You need all that to make thyroid. Now, these things will block it. Stress, infections, fluoride antagonizes the iodine. Yeah. Also increases lead absorption in your body. You see that with the kids. Yeah.
Does that mean like the fluoride in the toothpaste and the fluoride
Right.
in the water you're drinking
Right.
is going to affect your...
If you're iodine deficient, the body will selectively take up the healthy minerals. So if you have sources of iodine, then it will take the iodine over the fluoride.
Such as natural sources?
Right. Any source.
Food
Be
sources?
table salt that's iodized.
Oh, okay.
Obviously, as we know, we're called the goiter belt here because we don't get a lot of iodine. So it would depend on, again, if you have enough iodine, the fluoride is not going to be a big deal. But the fluoride water, and et cetera, et cetera, et cetera, at what point for the individual it can become a problem. Toxins we've mentioned, autoimmune disease, and celiac we mentioned. Again, to convert that, the enzymes need selenium and zinc. And on this side, again, stress, trauma, low-calorie diets, inflammation, toxins, infections, liver dysfunction, and medications can increase reverse T3. Then thyroid has to get into cell, into the nucleus is where it acts. So for it to be regulated and functioning properly inside the nucleus of the cell, you need vitamin A, exercise, and zinc. Okay, so just an overview to show you what's involved here. And the body does this without you having to think about it. I mean, that's the amazing thing, right? If you're eating healthy and you're exercising, all the stuff that we keep repeating, the body will know what to do. And I often like to go over that with patients to give really a sense of awe about it. In the next minute, your body will make 60 million white blood cells. Okay. Every 3 weeks, you get all new skin. When you take a bath, that's what's floating in the bathtub. It's dead skin on top. You make all new red blood cells every 3 months. Totally replaced. All new bones every 3 years. Every molecule in your bone is taken apart and put back together. And the intestinal lining, how many feet of tubing do we have between our mouth, esophagus, stomach, small intestine, large intestines?
33 feet.
Right? Somewhere in the mid-30s, depending. So it's 33 feet of tubing in here. If you opened it up flat, there's all the fingers, we call them Billy, opened up flat, how big would it be? A little smaller. Doubles tennis court, but big. So fold it up, here's a doubles tennis court. And how thick is the lining? Because you think about it, what goes through your gut is your real outside world. It's not in your body. We eat tons of food, right? And what's eliminated and what's inside you guys is not part of your body. Your body has to absorb it. So the surface area is as big as a doubles tennis court.
I knew it had something to do with sports.
Yeah. But that lining of the gut is replaced every 3 to 5 days. Every cell is. And that's the way the body keeps cleansing itself. So it's a lot going on, and they're going. Now, we always look at the positive. Why do you call it a thyroid problem when it's giving me an excuse for the 20 pounds I gained this year? So now you have a reason that you've gained weight. 2 good books I like. This gets a lot into autoimmune. Why do I still have thyroid symptoms when my lab tests are normal? This is first read about, this is Dr. Seamus and his wife. Apparently they work together, which is hard to do, work with your spouse. I tried working with my wife and she didn't like my jokes, but it was hard. But they talk about the systems a little more. This focuses more on the autoimmune.
Who is the author on the red colored book? I could not make it out against the.
Oh, I'm not. I'll have to spell it. Datis is the first name. Datis. Kharrzian.
Thank you.
It's a chiropractor.
What's the A in there when you, between the R and the Z?
Yeah, did I misspell it? Kharrrazin.
Z-I.
Z as in zebra. IAN. So, and these books approach it from different ways, but all the hormonal balances that connect to the thyroid, the toxins we just said a little about, there's not time tonight. We are thinking of doing a like a 3 or 4 week detox course for people how to stay healthy in a toxic world. I think that would be a good idea. And inflammation, all these things need to be looked at, to properly assess the thyroid. This is from the book by Seamus. I really liked it because I mentioned a 3-legged stool. There's stress and pollution. So that's I thought a great graphic. They have sex hormones a third. Like I would put, just for a little more involved, I would put the blood sugar, pancreas there, but it's a hormonal system is what they're trying to talk about there. So that can affect it. A great graphic, if the zinc is low, that stool is going to be tipped. Now 92% of the people I see have low zinc. again, it can be more or less a problem, but copper and zinc are antagonistic. And most of our water is from copper pipes, so that copper will block the zinc absorption. So depending on what's happening with the person, we always like to check a copper zinc. That's really important to look at that. It will depend on the person. If they have a lot of copper, if they have inflammation, inflammation increases copper in the body, which will block the zinc absorption. I saw this with my own son when he was 4 or 5 years old. I had to give him 150 milligrams of zinc a day to get past the copper block. So these are, standard lab tests are available from standard labs. It's best to get a serum copper and a plasma zinc. If you're going to ask about that, that would be the best way to do it. You can just use the serum. But we got to, figure out where all the blocks are, which way the stool is tilted to be able to intervene.
I'm sorry, could you go back to what was best, serum for what and plasma for what?
Yeah, serum copper and plasma zinc.
Okay, thank you.
That's the best way to look at the balance. And basically, you just want more zinc than copper. But when we do the initial tests, especially in the kids or an autistic spectrum, they'll just be way out of whack, have a lot higher copper. Question?
I understand that zinc's hard to absorb because it gets bumped off by other vitamins, so what's the best way to take zinc to get maximum absorption?
Right. There's 4 or 5 on the market. The most absorbable are zinc picolinate and zinc citrate. And of course, food, good food. Meat is high in zinc, but not solely. So those are the 2 best supplements. I think everyone could take 25 milligrams of zinc without a problem. But to answer your question, some people need a lot more to overcome that block.
I hear people asking questions about taking things, okay, like zinc and vitamin A. And it just so happens, I came out of the hospital and they told me I can't take any supplements because I'm on warfarin.
Well, no, that's not accurate. Warfarin is an anticoagulant.
Yes,
You want to stay away from this, things that might affect the bleeding time.
right.
But to say all supplements is really,
Well, that's what they did.
well, you can quote Florence Nightingale to them. Because it's like saying,
I guess what I'm getting to is now, how do if I'm to take care of myself, and I'm being inundated with all these different opinions, and they're coming from medical doctors, how do I get to the point where I know what to do? People say,
Well-
oh, take care of yourself. I say, I'd love to do it.
well, I think it gets back to one of the first things I said. Doctors do not have any special intelligence.
So who does? Someone's got to.
Well, it's a team approach. I didn't want to say it, but I do. But no, I was just joking. But
It would be nice
But-
to know if someone had.
But I think there is no someone. It's really you having to be proactive, because there's really 2 types of medicine. So I said, if you're hit by a truck or have severe chest pain, do not treat yourself. Okay. But 80% of healthcare now is chronic illness, where you can know more than the doctor. So tonight, your homework assignment is go online and look up warfarin, Coumadin, and supplements. And you're going to see there's like 95% agreement which ones might affect and which ones might not. And print it out and show it to your doctor. If they don't listen to you, fire the doctor.
And go look for another one
Right.
again.
What,
I went up to the Mayo Clinic, they went through what was happening, and they said, don't go back to that doctor, don't go back to that doctor. I'm sorry, I'm 68 right now, I'm tired of round robin.
I understand.
You know?
Well, I'll mention it when I am, but we don't really have health care. We have disease care in this country. So, what part of town do you live in?
Brookfield. I have a car.
No, I
Drive.
if you need a general doctor, there's Dr. Reynolds at Aurora. I like.
I just switched from Aurora to Freedom
Oh,
because of problems.
okay.
But
Well-
after I'd love to have his name, they can work in between, they don't work well, Aurora.
Yeah. Do you have any? Well, yeah. Well, we can talk about who might be some people in the system.
Okay.
And, this is what I think is really a good point, talking about the 3 legs of the stool. The doctor says if I don't feel better, soon he'll increase my estrogen. But that could just make the stool more tippy. So I think there's been, and this is a criticism, and not that I have all the answers, but in the integrated community, been a rush to give people hormones, before really thinking about or looking what the other options are. This one I like too. So if we got to measure everything, so we can keep the stool balanced. And then when that's true, you can shoot straight and eat cake once in a while. A question?
So you're saying estrogen is, I know it inhibits the thyroid, but there's different levels of estrogen. If you're low on one part, you need to actually supplement the bioidentical along with the progesterone if you're low.
Well,
But
the question is why you're low.
if you do know and you're working on it and you're still,
Well, no, if you know you're low, it's different than know why you're low.
but there's 5 different levels of estrogen.
Yeah, at least, there's E1, E2, and E3. And then those each have metabolites. I'm sorry?
There's like estrone, estradiol, estrase, estrogen. But, if you're low on one, it's not just that, it's the processed foods that are really not the normal foods, like tofu and miso, and it's the processed foods that can actually damage you, not the good estrogen in the processed foods. So the bioidentical estrogen is okay for you, correct, or not?
Well, again, I don't have a simple answer. I mean, what you're saying, I think I agree with, if I understand it. One is that trying to organize his thoughts here, but first thing is check your estrogen levels. When I check women who are postmenopausal, 85% have low progesterone, and the estrogen is normal. So and it's also the balance. And again, if you look at a chart of estrogen, I've never counted, but you could have like 20 different molecules in there. And then we try and break, we're talking about breaking things down in the systems, but generally there's considered 3 groups of estrogens: E1, E2, E3, estriol, estradiol, and estrone. And then they have many metabolites, but E2 is the highest level in your body, the estradiol. And that can go down different pathways. The 2 are the 16-hydroxy, and that's where the cancer connection comes in. But estrogen is a very protective, very good hormone to have. It may be the reason that, this is off topic a little bit, but I think I would bring it up. As I tell my 20-year-old daughter, females actually, get the words right here, outperform men in every area except short-term physical endurance. We're better playing football and clubbing animals. But in terms of left-right brain connections, longevity, handling stress, autism rates are 5-to-1, male to female. The survival of premature babies is much higher in girls, and it's getting worse for boys. It's about 4 or 5-to-1 at the same age of prematurity. So you can make a long list. But estrogen is a good hormone. It's actually antioxidant, protects memory and brain function. So, that's the background. On the other hand, in my system, usually, and there's always exceptions, but in terms of the triangles, the hormonal one, progesterone, estrogen, and testosterone, is the last one I'll look at because your body may be trying to compensate or may be low. So it just is an individual question. If you're going to supplement, do not use horse urine. Okay, does everyone know what I mean by that? Premarin, I was a little shocked when it actually comes from pregnant mares. That's the main estrogen, and that's what skewed all the studies about estrogen being dangerous. But like everything, what I said 15 years ago was the idea that every woman walking in the door needs estrogen was really fostered by the pharmaceutical companies. Just like now, they really want to put statins in the water. So it's just really common sense. I don't have a one-size-fits-all statement, but there's nothing wrong with estrogen supplement, in terms of knowing what you're doing. It's just, as I say, thinking it through a little more, or if needed. So yeah, we want to get in balance. Just want to mention this as another thing to be aware of, because ask your doctor to get the peroxidase antibody. The thing about most of the chronic unwellness, it happens slowly. You know, you're not normal thyroid and the next morning you're low thyroid, right? It's a slow progression. It's also increasing in incidence. So this study showed that if that's the antibody, thyroid peroxidase antibody, was high and the thyroid was borderline, what was probably the optimal or the new normal levels for TSH? Right. So once that TSH got above 2, which is still normal, and you had thyroid antibodies, you're just much more likely to get thyroid down the road. So it's not one point where you become low thyroid. And that's, this diagram is time on the bottom. So here's someone born, they have their genetics. Then pregnancy can affect thyroid. Autoimmune we talked about, environmental we mentioned. So then coming down the road, then your thyroid antibodies start to get a little bit elevated. Then the TSH gets elevated. Then this would be technically by the endocrinologist. If your TSH is high and your T4 is low, then you're low thyroid. If your TSH is high and your T4 is normal, then you're subclinical. And what that means, I don't know, but we have to impress patients and relabel things in Latin. You know, I'm always was amazed when I was learning it that if doctors were to speak in English, we would get paid less, but because you know the muscle in your back is called latissimus dorsi. Well, that's Latin for wide back. So if you went to a doctor and said your wide back muscle is strained, it wouldn't sound very good, right? Or as good as latissimus dorsi. Anyway, so that's just an idea where you are in this, you know, overlapping. It just would be the individual where they are. I have to figure that out. So here's optimal. T3, 3 to 3.8. Reverse T3 below the mid-range. Some people use ratios, but T3 and reverse T3 have different units, so you can't really compare them. You have to get the total T3 if you want to do that. TSH 1 to 2. T4 is probably the least important one to look at because it's not really the active thyroid hormone, and just somewhere in normal is actually okay, I think. Anywhere above low normal. Don't want thyroid antibodies. Basal temperature above 97.6. And it's just remembering you can't always compare the levels because different methodologies are used from different labs. So you have to look at the ranges and the units. Thyroid preparations, I don't know if Dan talked about that. Sometimes people are coming in desperate to get on the natural thyroid, which, as I said, in 80% of people will give a better response. But remember, if you have antibodies to thyroid, the pig is very similar to a human, I have to say. I wouldn't offend anybody. But we use pig heart valves, we use pig thyroid hormones. A respectable scientist, international expert in this field of anthropology, said October last year, if you can search, I forget his name, but that humans are a hybrid of a pig and a monkey. Evolution. I'm not making this up, but we're not going to get into religion or politics tonight. But the point is that your body can react to that pig thyroid gland the same as its own if you have antibodies, right? So some people feel worse, some people are allergic to pork. A lot of people like Well, nature thyroid and West thyroid I think are the same, but that seems to be one of the purest out there. Because different pharmacies have different ones, I generally will just write for desiccated thyroid, and then we can think about it if it's not working. But then the regular T4, of course, and then the T3, there's only one cytomel. Time-release T3 is really helpful in some people. That, of course, has to be compounded. And sometimes time-release T4.
On the type that you have, what's the difference, for example, between levothyroxine and the one above it?
Yeah, these are all T4. There's no difference.
Oh, they're all T4?
These are brand names.
Oh, those are brand names.
Right.
They're all the same thing.
Right.
Okay. And they're all synthetic.
Maybe. I mean, they're made in the laboratory,
Okay.
but they would be called the same molecular structure as your body's thyroid.
And when you say antibodies affect it,
The
are you
thyroid?
saying if you have like an autoimmune disease,
Right.
like Sjogren's, would that affect your thyroid?
Not directly, no. But Sjogren's affects your connective tissue, and
Yes.
you know,
And
but it could lead to thyroid problems. I think there's a higher incidence of thyroid problems with autoimmune disease. It's another interesting topic we don't have time to talk about, but the new understanding in autoimmune disease is really antigen overload. It causes it. Some really good research in Israel where you could not, and the authors, they said we couldn't believe it basically, but you couldn't get autoimmunity in an animal unless it was overloaded with antigen. Now we're all over, because of leaky guts and synthetic and processed food, we'll all get antigen overload. And perhaps even getting too sterile environment is affecting our immune systems. Hygiene hypothesis. We need to be rolling in the dirt and have kids growing up on the farm. They have less allergies. So that's another important. But there's only one form of T3, cytomel. We mentioned time release. I will make one comment and have to congratulate the FDA. It's not something I do often, but it's about 4 years ago, if you were on thyroid, you really had a hard time getting the desiccated or armored thyroid. Remember that? Mm-hmm. And the reason was because it was from a biological organism, a pig. The amount of thyroid would vary in the pig gland. And so the FDA said, no, there's too much variability, and stopped the sale of the desiccated thyroid. And of course, then the conspiracy theories came out, which I don't know, that the pharmaceuticals didn't want people to be buying the desiccated because they didn't make as much money, because there's so much pig thyroid lying around, it's pretty inexpensive. But the FDA forced the manufacturers to standardize the thyroid dose, so we now know for 60 milligrams, which is 1 grain of thyroid, there's 38 micrograms of T4, and it's 8 or 9 micrograms of T3, which is a good thing, because then you know what you're getting in that thyroid. So before that, could be a problem, because there's a lot of variation. So that's a good thing the FDA did, was have that standardized. So again, reviewing normal physiology is always what we want to achieve. Then be aware of the stress-mind-body connection. Natural treatments. As I mentioned, when thyroid's involved, we might want to consider the pharmaceuticals sooner. And I know a lot of people come to me saying, I don't want to take pharmaceuticals. And there's low thyroid, and there are things to support it. So I'll discuss that with the person, Most of the time I'll explain that, I'm your consultant. I'm not giving grades, not being parental. So, it's up to you, but I'm the consultant. It's your decision. And so sometimes that's not always true, but usually. So I think we're at a crossroads now between disease care and health care. We won't talk about the healthcare system tonight, or we wouldn't be leaving soon, but we need health care, not disease care. That's the primary function. New ways of thinking. We talked about systems biology, functional medicine. It's not just genes. There's a huge overemphasis on genetics. I'll just say a couple things because I think it's really important. Do you know what percentage of your DNA codes for proteins? 2% of all your DNA is coding for proteins. What's the other 98% doing? The term was coined junk DNA, but the DNA is a lot. We talked about the body. DNA is incredibly more complicated than that, and no one's figured it out because an onion has more genes than you do. When I was in medical school, I thought there'd be 200,000-300,000 genes that make proteins because we have that many proteins, then 150, and it turns out you have about 21,000 genes. So knowing how all these proteins are being made, you know, worm has 14,000 genes and onion has 31,000. So therefore we're a little smarter than a worm and dumber than an onion. But the whole DNA thing is pretty interesting, the control levels. But there's just way overemphasis on genes. But again, in rare cases, it makes a difference. But most of the time, it's not your genes. There's not a lot of bad genes. It's what you do with your lifestyle and your environment.
What about the hereditary factor in hypothyroidism?
Yeah, the predisposition, but I think it's mostly environment.
Okay.
Because you'll read about cancer and all that. And, who's the person who had double mastectomy? That, yeah. Well, she had that BRCA gene. Okay. Well, two things. Does anyone know what the cancer rate was in 1900? It's for extra credit. It was 1 in 75. 100 years ago. Now, we knew what cancer was 100 years ago. Okay, so I'm going to say, and there was lots of old people around 100 years ago. Today, the cancer rate is 1 in 2 men, 1 in 3 women. Now, that includes skin cancer. So, we're seeing huge change. Most of them, I think, are environment. Now, the BRCA gene, which can increase cancer. If you had the BRCA gene in 1915, your chance of getting breast cancer would be about 13 to 14%. Now, if you have the BRCA gene now, your chance of getting cancer is like 65 to 70%. Now, our genes did not change in 100 years, if you follow me. So it's the environment washing over the genes. And food talks to our genes. This is another good talk. We just had our food as medicine conference. But food is information. And then what we're doing to our diet is, of course, making our country unsustainable, just talking about diet. You know, a teenager today has a 1 in 3 chance of being diabetic by the time they're 40 years old. That's not sustainable. I do go over with all patients the addictive nature of food. Did anyone see it about 3 months ago, the headlines? Oreo is more addicting than cocaine. And this is not a joke, the animal studies. There's more brain changes with Oreos than cocaine, probably because food is important to our survival. So, a book came out about 6 months ago called Salt, Sugar, Fat by Moss, M-O-S-S. I do recommend everyone read it. He studied the food industry for 5 years, and basically Kraft Foods has 300 people working around the clock to get you to eat more. They found that if a potato chip crunches at 3.5 pounds per square inch pressure, the crunch, you'll eat more. So they're doing everything they can, and they actually call it the bliss point in the food industry. The fat-sugar ratio, it's about 5 to 1.
I'm sorry, who is the author again?
Moss, M-O-S-S. He's a New York Times Pulitzer Prize author, which is the same ratio as mother's milk. So our tongues are connected to our brains. Dr. Oz, a few months ago, sugar, the new cocaine. So, and about a tax on sodas. Anyway, interesting times, but this all does affect the thyroid. So I like to say forget diagnostic labels. Does everyone know what a CPT code is? That's what a doctor, if like you have fatigue, it's 780.9, they'll put that number. Because that's what goes to insurance. Fatigue is not what goes to insurance. That number goes to insurance. So there are now 15,000 numbers. Okay. That's the old system. The new system is going to have like 48,000. And if you saw some of them, it's pretty funny like, what they're labeling. So everything has a place, but I don't find them that helpful because people, like fibromyalgia is not a disease. It's when you don't know what's happening, you call it fibromyalgia. And then if you see the doctor and if they like you, they'll say it's a virus. If they don't, they'll say see a psychiatrist. That's a lot of what's done. But turning what's out of balance, how to restore normal physiology. One of my heroes, I just put this in terms of ways of thinking. What's obvious? I think everyone in this room probably doesn't need to be here in a sense. Because what I'm saying to you is pretty obvious, right? I mean, if you disagree, I won't take it personally. Speak up, or if there's an honest disagreement or healthy skepticism. But, these are ideas that were soon to be true. Earth is flat. Children should be seen and not heard. That's a good one. But that was literally true, not just a phrase. I mean, airplanes are impossible. Women are not logical enough to vote. I just heard that Abraham Lincoln was the first president to support women's right to vote. So was 19th Amendment was like in the teens, 7 years later. Autism caused by bad parents, that one we mentioned. Thyroid function equals TSH, so that's changing. So we do know enough together that we can really optimize an individualized thyroid treatment. So thanks for your time and good to be here.